Welcome to ASCP Practice Questions. Today we'll test your ability to think like a real medical laboratory scientist. You are the only MLS on night shift. At the same time, you receive a stat CBC from the ER, a blood culture from a septic patient, a critical cross-match request for the OR, routine morning chemistry samples. Which specimen should be prioritized first? A. Routine chemistry samples. B. Blood culture from a septic patient. C. Stat CBC from the ER and D. Cross-match request for surgery. Pause and choose your answer. Answer: D. Cross-match request for surgery. A patient who may require immediate transfusion is at risk for life-threatening blood loss. Cross-match requests related to active surgery or emergency transfusion generally take highest priority because delays can directly impact patient survival. After addressing the urgent transfusion need, the blood culture and other stat specimens should be processed according to hospital policy and clinical urgency. Blood culture versus antibiotics. The nurse calls and says antibiotics will be given in 10 minutes. The blood culture has just arrived. What should be prioritized? Answer: blood culture processing, because cultures collected after antibiotics may become falsely negative. Critical potassium versus routine samples. You notice a potassium result of 7.2 millimole per liter while routine chemistry samples are waiting. What should you do first? Answer is check for hemolysis and verify the result. Before a critical potassium result is acted upon, the MLS should verify its validity by reviewing specimen quality and instrument data. Once confirmed, the result can be released according to laboratory policy, and critical value notification procedures should be followed. Clotted CBC versus new stat sample. A clotted CBC specimen arrives together with a new stat CBC from the ER. What should be addressed first? Answer: the stat specimen, while documenting and requesting recollection of the clotted sample. Critical platelet count. A CBC result shows platelets equals 8 times 10 to the power of 9 per liter. No analyzer flags. Patient is an oncology patient. What should the MLS do first? Answer: verify the platelet count on smear. Critical platelet counts should be verified according to laboratory policy. A smear review can help identify platelet clumps or other factors affecting the count. Delta check failure. Today's hemoglobin is 7.0 grams per deciliter. Yesterday's hemoglobin was 12.5 grams per deciliter. The patient is stable and no bleeding is documented. What should the MLS do first? Answer: verify patient identification and specimen integrity. Large unexpected changes may indicate specimen or identification errors. Possible EDTA contamination. Chemistry results show potassium is 7.8 millimole per liter. Calcium is very low. Patient has no symptoms. What should the MLS suspect first? Answer: EDTA contamination. EDTA contamination commonly causes falsely elevated potassium, falsely decreased calcium, falsely decreased magnesium. A patient received blood 6 months ago. Current testing shows antibody screen is negative. Cross-match is incompatible. What is the most likely explanation? A. ABO typing error. B. Weak or evanescent antibody. C. Instrument malfunction. D. Wrong blood type. The answer is B. Weak or evanescent antibody. Some clinically significant antibodies may become undetectable over time but can reappear after exposure to antigen-positive red cells. Always review the patient's antibody history. Emergency blood can save a life, but carries risk. The operating room calls. The patient is actively bleeding. There is no time to complete full compatibility testing. What blood product is commonly issued in this emergency? A. Fully cross-matched blood only. B. O-negative red cells. C. AB positive plasma only. D. Group-specific blood without testing. Answer: B. O-negative red cells. O-negative red cells are often used during life-threatening emergencies when transfusion cannot wait. The priority is preserving life while compatibility testing continues. Follow for more lab insights.